The most common TRT mistake isn't what you think it is. It's not your dosage. It's not your compound choice. It's not even diet or training. The number one TRT mistake destroying men's health is injection frequency. I'm Tony Huge, JD medical lawyer, and I've been documenting TRT protocols for a decade. Today, I'm exposing the injection schedule that's keeping you trapped in a hormonal roller coaster. Every 2 weeks, millions of men inject testosterone and wonder why they feel like garbage. They get their shot, they feel amazing for 3 days, and then they crash hard for the next 11 days. Their doctors call it normal. I call it medical malpractice. As a medical lawyer who defended the research chemical industry from regulatory annihilation, I've seen how broken protocols destroy lives. The biweekly TRT protocol isn't just ineffective, it's actively damaging your health, your relationships, and your future. But here's the biochemical reality that your doctor won't explain. When you inject 200 milligrams of testosterone cypionate every 2 weeks, your levels spike to over 1,200 nanograms per deciliter within 48 hours. That's super physiological. Then, over the next 12 days, you crash below 300 nanograms per deciliter. That's hypogonadal. You're spending 80% of your time hormonally depleted. The half-life of testosterone cypionate is just 8 days. That means every 8 days, half of your injection is already gone. By day 14, you're running on fumes. Your brain, your muscles, your sex drive, everything dependent on testosterone is starving. Meanwhile, during those first 3 days of supraphysiological levels, you're converting excess testosterone into estrogen through aromatization. High estrogen plus crashing testosterone equals the worst of both worlds. Mood swings, water retention, erectile dysfunction, and metabolic chaos. The pharmaceutical industry is designed for biweekly protocols for one reason: compliance. They wanted a protocol that's so simple even the laziest doctors could follow it. Inject once every 2 weeks. Check a lab every 6 months. Bill insurance. What they created was a hormonal disaster. Studies show that biweekly testosterone injections cause higher rates of polycythemia. Your blood becomes dangerously thick, increased cardiovascular stress from massive hormonal fluctuations, higher estrogen conversion during peak levels, more frequent mood disorders, and relationship problems. The clinical data is clear. Men on biweekly protocols report 40% more side effects than men on proper injection frequencies. But here's what we do differently. We use evidence-based protocols that optimize your hormonal stability. Physicians that I work with prescribe testosterone cypionate or enanthate in smaller, more frequent dosages. This maintains steady state levels between 600 nanograms per deciliter and 900 nanograms per deciliter consistently. No peaks, no crashes, no hormonal roller coaster. Physicians that I work with understand that optimization requires precision, not convenience. Legal loophole and compliance. Here's the medical legal framework that protects physicians who prescribe more optimal protocols. The Endocrine Society clinical practice guidelines state alternative dosing of 75 to 100 milligrams intramuscular weekly or 150 to 200 milligrams intramuscular every 2 weeks may be considered. The FDA approvals for testosterone cypionate and enanthate include dosing ranges from 50 milligrams to 400 milligrams every 2 to 4 weeks. This gives physicians a broad discretion to optimize injection frequency based on patient response. Any doctor refusing to adjust your injection schedule is practicing defensive medicine, not evidence-based medicine. You have the legal right to request protocol modifications based on symptom tracking and lab results. If your current provider won't optimize your injection frequency, then that's grounds for seeking a second opinion. Doctors I work with operate within these legal frameworks while prioritizing patient outcomes over convenience. The protocols I coach include testosterone cypionate or enanthate with flexible dosing schedules, HCG to maintain testicular function and fertility, and anastrozole for estrogen management when clinically indicated. Comprehensive monitoring, including testosterone, estradiol, hematocrit, and PSA, all prescribed by licensed physicians using FDA-approved medications. Protocol integration. Here's the optimal TRT protocol based on my decade of documentation and working with enhanced clinics and clinical experience. Primary base, testosterone cypionate, 80 to 120 milligrams, administered twice weekly, Monday and Thursday, injections to maintain stable levels without peaks or crashes. Fertility preservation with HCG, 250 to 500 IU administered on injection days to make it simple and convenient. This maintains testicular function and prevents atrophy, and estrogen management. Anastrozole 0.25 milligrams, low dosage, twice weekly, only if estradiol exceeds 40 pg per ml. Most men don't need an AI with proper injection frequency. And then recently, we're also adding enclomiphene into the protocol at just a low dosage of 12.5 milligrams per day for most men. The monitoring protocol: labs every 8 weeks for the first 6 months, then every 12 weeks. Track total testosterone, free testosterone, estradiol, hematocrit, and liver function. The goal is total testosterone between 700 to 900 nanograms per deciliter, with free testosterone in the upper normal range. The clinics that I work with provide these medications through their telemedicine platform with physician oversight. No more dealing with doctors who prioritize convenience over health. Synergy and next steps. This isn't just about injection frequency. Proper TRT optimization requires understanding the enhanced matrix pathways. Pathway 1, androgen receptor optimization. Consistent testosterone levels maintain steady androgen receptor activation. No more receptor downregulation from hormonal fluctuations. Pathway 2, estrogen balance. Smaller, more frequent injections reduce aromatization compared to large bolus doses. Your estrogen stays in the sweet spot for bone health and libido without excess conversion. Pathway 3, HPTA preservation. HCG and enclomiphene maintain your body's natural hormone production signaling. This preserves fertility and prevents complete shutdown. Pathway 4, metabolic enhancement. Stable testosterone levels optimize insulin sensitivity and fat metabolism. No more energy crashes that derail your diet and training. The synergy between proper injection frequency and these pathways creates exponential benefits. The clinics that I work with integrate all of these elements into a personalized protocol. Commonly asked questions in my answers. Can I switch from biweekly to twice weekly injections immediately? Yes, but work with a qualified physician to adjust your total weekly dosage. You'll probably need 20 to 30% less testosterone per week with improved frequency. Question: what if my doctor refuses to change my protocol? There's plenty of clinics I work with where the telemedicine consultants and the physicians specialize in optimization protocols. Many patients transition to these clinics for this reason. Question: how quickly will I notice improvements with better injection frequency? Most men report more stable energy and mood within 2 to 3 weeks. Full optimization takes 8 to 12 weeks as your body adapts to the consistent levels. And remember, this content is for educational purposes only and doesn't constitute medical advice. Always consult with a qualified healthcare provider before making treatment changes. If you're ready to optimize your testosterone replacement therapy protocol with proper injection frequency, then check out my materials that offer comprehensive telemedicine consultations with experienced physicians. Don't let outdated protocols destroy your health when the solution is simple, the enhanced way, the evidence-based way, the only way that works for optimal human optimization.